One night you lie down to sleep and a strange itching begins. Not a rash, not a mosquito bite, just a deep, persistent itch under the skin. You scratch it. It fades for a moment. Then it comes back. The next morning it's still there. A few days pass. No redness. No visible irritation. Just an itch that refuses to leave. If you are over 50 and experiencing unexplained, stubborn itching, this is a video you need to watch until the end. Because sometimes the body whispers before it screams. And sometimes what feels like a minor skin annoyance can be an early internal warning sign. Let's be clear from the beginning. Most itching is harmless. Dry skin, allergies, medications, seasonal changes, these are common causes. But when itching becomes chronic, unexplained, and persistent, especially without a visible rash, doctors start thinking differently. Here's why. When certain cancers develop, particularly blood-related cancers or tumors affecting internal organs, they can release proteins and inflammatory chemicals into the bloodstream. Your immune system reacts. That reaction can stimulate nerve endings beneath the skin. In other words, sometimes the skin isn't the problem. The nerves are. Large clinical reviews have shown that chronic, unexplained itching in older adults is sometimes associated with systemic disease. This does not mean itching equals cancer. It means persistent, unexplained itching deserves attention, especially when combined with other symptoms. So what should raise concern? First, itching concentrated in the palms of your hands and soles of your feet. If the itch feels intense in these areas and worsens at night, it can sometimes be linked to bile flow problems in the liver or gallbladder. When bile acids accumulate in the bloodstream, they can trigger severe itching. In rare cases, this may be associated with liver, bile duct, or pancreatic conditions. Second, full body itching with no rash. If your skin looks completely normal, no redness, no eczema, no hives, yet you feel persistent itching everywhere, doctors consider systemic causes. Blood cancers such as lymphoma are known to present this way in some patients. The itching may precede diagnosis by months. Third, itching combined with painless swelling in the neck, armpits, or groin. Enlarged lymph nodes that feel firm and do not hurt paired with persistent itching should always be evaluated. Your lymphatic system is part of your immune defense. When it changes, your body is signaling something important. Fourth, itching with unexplained weight loss. If you haven't changed your diet but you're losing weight, feeling fatigued, and noticing persistent itching, this combination should not be ignored. Unintentional weight loss is one of the strongest general warning signs in medicine. Fifth, night sweats plus itching. Waking up drenched in sweat while dealing with ongoing itching for more than 2 weeks moves the situation out of the simple allergy category. Night sweats, weight changes, and chronic itching together require medical evaluation. 6. Scalp itching with unusual hair thinning. Most scalp itching is benign, but when it's persistent, unexplained, and paired with localized hair loss or thickened skin patches, a dermatologist should examine it carefully. Again, let's pause here. Not every itch is dangerous. Diabetes, kidney disease, thyroid disorders, medication side effects, and even anxiety can cause persistent itching. The key word is unexplained. If you are over 50 and itching lasts more than 2 weeks without a clear cause, don't just apply cream and hope for the best. A basic blood panel can reveal liver function changes, kidney markers, thyroid levels, inflammatory signals, or blood abnormalities. Early testing often means early answers. Your skin is not just a covering. It is a messenger. Now let's shift to prevention because reducing cancer risk is not about fear. It's about daily choices. Research consistently shows that roughly 30 to 50% of cancer cases are linked to modifiable lifestyle factors. That means prevention is powerful. Start with nutrition. Your cells rely on what you feed them. Diets high in processed meats, such as sausages and cured products, have been classified as carcinogenic by major global health authorities. Reducing processed foods and increasing whole, natural ingredients matters. Think in colors. A plate filled with deep greens, reds, oranges, and purples delivers antioxidants that help neutralize cellular damage. Leafy greens, cruciferous vegetables, berries, tomatoes, carrots, these are not trends. They are protective tools. Fiber is critical. Whole grains and legumes support gut health and help lower the risk of colorectal disease. Your digestive system plays a major role in immune balance. Limit alcohol. When alcohol is metabolized, it forms acetaldehyde, a compound that can damage DNA. Even moderate consumption has been linked to increased risk in certain cancers. Avoid tobacco entirely. Smoking does not only affect the lungs. It is strongly linked to cancers of the mouth, throat, pancreas, bladder, and more. Even secondhand exposure increases risk significantly. Maintain a healthy weight. Excess body fat is not just stored energy. It acts like an endocrine organ, releasing hormones and inflammatory molecules that can promote tumor growth. Obesity is associated with multiple cancer types. Move daily. Just 30 minutes of brisk walking can improve immune surveillance. Exercise increases the activity of natural killer cells, part of your body's frontline defense against abnormal cells. Protect your skin from ultraviolet damage. Skin cancer remains one of the most common yet preventable forms. Avoid peak UV hours when possible. Use protective clothing and never rely solely on sunscreen. Avoid tanning beds entirely. Artificial UV exposure significantly increases melanoma risk. Vaccination matters. Certain cancers begin with viral infections. Vaccine for hepatitis B reduces liver cancer risk. HPV vaccination dramatically lowers the risk of cervical and other HPV-related cancers. Screening saves lives. Cancer is most treatable when found early, after age 40 or 50, depending on personal and family history. Regular screening such as mammograms, colonoscopies, prostate evaluation, and skin exams become essential. Self-examination also matters. Knowing your normal baseline helps you detect change. Finally, reduce environmental toxin exposure where possible. Avoid heating food in plastic containers. Improve indoor air quality. Be mindful of occupational chemical exposure. Small daily reductions add up over decades. Here is the most important message. Cancer is not always sudden. It is often a process. And many times, the body signals that process early. An itch that won't go away may be nothing, but it may also be a whisper worth listening to. Pay attention to patterns. Notice combinations of symptoms. Act early, not late. Early action does not create fear, it creates control. If this information helped you, share it with someone over 50 in your life. A simple conversation can lead to a simple test, and a simple test can change everything. Stay informed, stay proactive, and most importantly, stay attentive to what your body is trying to tell you.